everybody. Today we are going to discuss use of national standing orders by John Abiodun Noah, BSc Public Health, PSc tutor, works at the Department of Community Health, Nana College of Nursing and Health Sciences, Ayingba, Dekina local government area of Kogi State. The national standing orders for community health extension workers. This document is produced in collaboration with the National Primary Care Development Agency, produced by the Community Health Practitioners Registration Board of Nigeria. This is the 2024 edition, and we are going to discuss how to use it. This becomes imminent because the current situation is that students are just getting this document for the first time, and it is quite different from the 2015 and the 2010 standing orders. So there is need for us to actually put out uh, uh, um, a training document like this to enhance the ability of the students to quickly catch up before the August national qualifying exams. So in view of this, I just put up this as the first set of video. I'll be doing other videos on how to use these national standing orders. So the outline that we're going to talk about today is as follows. Introduction. We're talking about introduction, definition of the national standing orders, how to use the 2024 illustration guide, benefits of the illustration guide, sections of the national standing orders for CHU, steps for the use of the national standing orders, practical steps. Then the steps for the use of the national standing orders in theory, we'll be doing that in a subsequent video. But for today, we are only going to discuss the step for use of national standing orders practically, and we are going to use a case study or a case. We're going to draw out a case and use it to search for the appropriate as appropriate, and go to the situation, the finding, and be able to handle one case for today. So introduction, the National Standing Order has been a very old document which has undergone several reviews. It dates back as far as the advent of the Basic Health Service Scheme, BHSS, which metamorphosed into the primary healthcare system we have today. Standing Order is meant to provide legal backing to the technical competence of all primary healthcare workers who use this very important document. It is designed to be used by community health practitioners and should also be adhered to by doctors and other health workers in primary health care settings, unless there is a valid medical reason to deviate from them. Standing Orders is a book designed to guide actions in a way that ensures a uniform standard of treatment and handling of all other health-related situations. The purpose of the purpose underlying the study of standing orders is to develop greater capacity in client-patient management at the community and health facility levels. Let me quickly say that this document is a document meant for professionals. The professionals are the community health practitioners, and only people with valid license to practice are expected to handle this document. So anyone who is not a practitioner is not allowed to handle this document, because what you have not been trained to use, even if you think you can read and understand it, at the end of the day you might make a mess. And if you mess up with the process and you do not have a license to practice, you can be sued and be jailed for whatever actions you have taken. So it is strictly meant for those who have license to practice, or students who are currently in training and they are receiving this training on how to use these documents. So let's go further. The definition of the standing orders. We have three definitions currently. The first one is the 1995 definition, which defined the standing orders as a set of specific guidelines arranged by symptoms which define how clients with different conditions should be cared for. While the second definition is the 2010-2015 definition of the standing order, which defines it as a set of specific guidelines arranged by age group, disease conditions, findings, clinical judgment, and actions which define how clients will be cared for. So the current 2024 edition has its definition as an essential guide designed to support the effective delivery of healthcare services by community health practitioners across Nigeria. That is the current definition that is given to the standing order. The standing order is developed by the Community Health Practitioners Registration Board of Nigeria in collaboration with the National Primary Healthcare Development Agency, with support from the USAID Health Workforce Management Activity. This comprehensive manual provides standardized procedure and protocols for managing a wide range of health conditions and scenarios encountered in primary healthcare settings. So the definition has actually changed from the previous 1995, the 2010, and the 2015 definition. So there are slight changes. This one is regarded as a guide, an essential guide, which supports the community health practitioner in carrying out his or her role. So let's look at how to use the illustration guide. The first thing is to familiarize yourself with the content. You begin by reviewing the table of content to understand the scope and structure of the guide. This will help you quickly locate the relevant sections and subsections as needed. Then next you navigate to the sections and subsections. Each of each of the 8 sections cover a specific aspect of healthcare. You identify the sections relevant to your current need, e.g., newborn care, maternal health. Then you utilize the subsections to find detailed protocols and procedures for specific conditions or scenarios. So instead of talking about findings, they're talking about subsections. So we'll be looking at what that implies later. Then the third thing is to study to understand the procedures carefully, read the test descriptions to understand the context and detailed steps involved in each procedure. Refer to the accompanying illustrations to get a visual understanding of the procedures and clinical signs. Then the fourth step is to apply the information. Use the guide as a reference during patient care. The clear steps and visual aids will help ensure that you follow the correct procedures. In case of emergencies, quickly refer to the relevant section to guide your actions. So number 5 step is to review the content or review the guide periodically. Regularly revisit the guide to refresh your knowledge and stay updated on standard procedures. Engage in continuous learning by discussing the content with peers and supervisors. By doing so, there are some areas that may still be lacking, which you could come up with and jot them down against anytime there's a review. You can bring up such issues. Then the sixth step is to adhere to the guidance and standards. Follow the documentation guidelines provided in the guide to ensure that all procedures and patient interactions are accurately recorded. Utilize the templates and tools included to maintain consistency and compliance with national health standards. So this is the sixth step. Let's look at some of the benefits. Benefits of the guide. The first benefit is that it enhances understanding. Illustrations provide clear and concise visual explanations of complex medical procedures and conditions, making it easier for health practitioners to grasp and remember key concepts. Now, the illustration we are seeing here is a clear indication that the baby has discoloration of the skin. We can see the yellowness around the skin of the baby, which is a case of jaundice. So that helps you to know that, okay, when you see babies like this and you are seeing the image there and you are seeing the baby right in front of you with that discoloration, and you are looking at this image and it looks exactly similar, it will tell you that the baby is having jaundice. To improve retention, visual aids have been shown to improve memory retention. The combination of text and images helps reinforce learning and recall of important information. Yes, like this, what we have here is a baby that is seen to be bleeding from a circumcised wound. And because of that, when you see it, you quickly be able to remember that, oh, this is the situation. Benefit continue. Now, the illustration can depict step-by-step procedures, helping practitioners to visualize the correct techniques and methods, which is crucial during emergency situations or routine care. Then the fourth benefit is accessibility. Visual content transcends language barriers and can be especially helpful in diverse regions where practitioners may speak different languages or dialect. Now, sometimes images of measles, images of other conditions, once they see it, the people can understand even without any discussion. The image can portray what their babies are passing through and it help the patients to seek care immediately. Like the illustration we have here, we can see the bluish color of the arms and the legs and the body of the child. That's a clear case of asphyxia, and it is an indication for resuscitation. Then we have engagement. Illustration guides are more engaging and can maintain the interest of practitioners, encouraging them to refer to the guide more frequently and thoroughly. Sections of the 2024 National Standing Orders. We have Section 1, which is the newborn, which is from birth to 28 days. It deals with newborn babies' health conditions, whether they are well or they are ill. Then we have early childhood from 1 month to 5 years. This one deals with children within the age range of 1 month to 5 years, health conditions, whether well or ill. Section 3, middle childhood, 6 to 12 years, deals with children within the age range of 6 to 12 years, health conditions, whether well or ill. So, Section 4, adolescent treatment, deals with children within the age bracket of 13 to 17, transitional period from childhood to adulthood, about puberty concerns, sexuality concerns, and other behavioral issues and the rest. Section 5 is adult health, deals with the first visit of adults and all the problems affecting adults. Section 6 is maternal health, deals with issues relating to pregnancy. Section 7 is the elderly treatment, deals with the problems associated with the aged. Then the appendix are other conditions which are very, very important, but they are not in the standing order. Now we are going to take a case. We're going to take a case, the step to discuss the step for the use of the National Standing Order, practical steps. So we're taking the case of Mrs. Olorun Shogo, who walked into the health facility and complained of bleeding from the vagina with lower abdominal pain, and her last menstrual period was 8 May 2025. So as at today, it will be 9 weeks and 2 days. Today is 12th July 2025. So it will be 9 weeks and 2 days today. So she's not up to 20 weeks. So we have to manage her condition according to the standing order. So the step that the student is expected to take is, first, the student is expected to create a rapport with the client by you sit the client down, you greet the client, you reassure the client, you identify yourself, and any procedure that you want to carry on the client, you need to take permission from the client. So for practical purpose, for exam practicals, you may not necessarily take permission from your supervisor, but you speak with to your client in a way that the supervisor or the examiner is listening to you. So every discussion you have with the client, how you welcome the client, how you greet and reassure the client, the supervisor is watching and is hearing you. The next thing is to obtain patient's client's card containing their personal data. which is the name, age, sex, tribe, religion, occupation, marital status, address, phone number, and possibly email if they have. Now, when you take these ones down, then the next thing is to obtain the complaint, which is in this case, she's going to say that she's having bleeding from the vagina with lower abdominal pain, and her last menstrual period is May 2025. It's about 9 weeks to 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 date. So the fourth step will be to turn to the appropriate section and locate page in the standing orders of complaint. Now, the case of Mrs. Olorun Shogo, is that of bleeding per vagina with lower abdominal pain, and based on how we calculated the last menstrual period, she's just about 9 weeks and 2 days old. So if we look at that scenario fall under maternal health because she's pregnant. Section 6 talks about maternal health. Section 6, you can see it here, Section 6, maternal health. So, and her case is 9 weeks, which means she's not close to labor and delivery yet. So she will be under prenatal antenatal care, which is page 652. So we're going to turn to that page. Then, while we have taken the complaint, then you're going to write citation, that's the name of the document, edition, section, page, and the findings. Now, the National Standing Orders for CHU 2024 edition, section 6, as we can see here, section 6, page 652, page 652. So that is how the student is expected to write it out. Now, with that, we'll go to the next step required. Now, in page 652, we are here now. We have to take history. We have to obtain appropriate history. So we're going to ask all these questions. How are you feeling? What are your symptoms? And of course, she's feeling ill because she's having bleeding. So when you say, how is she feeling? She'll tell you she's not well, she's feeling ill. Symptoms are bleeding per vagina and abdominal pain. Is there any problem sleeping? Of course, she won't be able to sleep. Do you sleep well? Not at all. Do you get easily irritated, anxious, or depressed? She will be anxious and depressed, afraid of losing her pregnancy. How is your appetite? So all these are questions that will be asked, and the client is expected to give appropriate answers to those questions. Social history. Social history talks about the lifestyle that Mrs. Olorun Shogo has been living, whether she takes alcohol, whether she takes substance, whether she has domestic problem in the home, her husband beats her at any given time, and whether she has medical problem, any other medical problem. So these are social history. Then for first contact only, medical history is required. You need a medical history for those who are coming for the first time because you want to know their past records of previous deliveries and uh, conditions, sicknesses that they have on them, and whether they have done CS, whether they have had immunizations, TT, and the rest. So these are medical histories which will be taken at the first contact. So obstetric history talks about previous pregnancies and deliveries, whether they have had children that have died, whether she has had stillbirth, miscarriage, or the number of children alive, and the rest like that. These are the history that will be taken at from as obstetric history. Then you have to wash your hands using the appropriate technique, which we are also going to display in a subsequent video. Then you need to now set appropriate tray where necessary. Then you do general examination. So the first thing is to look at the general appearance of the client. You look at her face expression, ill looking or well. Then you look at the skin for pallor, rashes, sores, and any other sign of domestic violence like beating and bruises and cuts and the rest. Look at the eyes for redness, jaundice, pallor, and the rest. So check the nose, check the mouth, check the chest, and the breast, check for lumps and tenderness and rest. Check the height and record. Check the weight and record. Blood pressure and record. Temperature and record. Then pulse rate and record. So these are the steps that are expected to be taken by each student during practical examination. Then the last one is the obstetric examination. You have to do inspection of the abdomen, the size, check if there is a scar, measure the fundal height and record, palpate the fetal heart parts and the presentation, do auscultation. Pelvic examination is expected to be done after 35 weeks. And then, but for her case, we may not necessarily need to do pelvic examination because you just palpate her to see the height and see other issues that are concerned. Then check the external genitalia and use speculum to check and see if the cervix is dilated or not. So these are the obstetric examination that are expected to be done by the health worker. Then you conduct laboratory investigations where applicable. Uh, First visit only, you do HIV counseling and testing, and you can enroll the client for antiretroviral therapy, do venereal disease research laboratory and rapid plasma reagent for syphilis. You do blood grouping and results determination, any appropriate investigation as indicated by patient condition like hepatitis and the rest. Then at all visits, you must perform urinalysis and hemoglobin estimation because this is very, very important. Then ultrasound scans for at least from 24 weeks upwards. You send them for scanning. So these are the ways to carry out the investigation that are necessary. Now, if there's a multiple complaint, you will need to prioritize the findings. Then you have to, after getting your complaints and doing the examination, you go to the next page, page B, complaint B, and do the examinations there as well, and now harmonize your findings if there is a multiple complaint. And such complaint may be that, okay, she's having this condition and she's still having fever, or she's having the bleeding per vagina and she's still having headache, or she's having vomiting. So these are multiple complaints, and those multiple complaints should be treated differently. Only that similar questions that you have asked before, if they pop up again, you may not need to ask those questions again because she has given you the answers previously. So the next thing is to use appropriate listed conditions. Now, in this case, they didn't tell us findings one, findings two, findings three, findings four. So the condition, that the way it is listed, we just say list appropriate condition. That is it. So use appropriate condition. So in this case, find in the second condition that is listed there is that bleeding from the vagina before 20 weeks of gestation, with or without lower abdominal pain. So she has bleeding from the vagina and she's not up to 20 weeks of gestation, but she has abdominal pain. So this condition fits her description properly. So it is on finding two. So, and the expected actions under it are listed below. Says assess vaginal bleeding for passage of dots, of clots, or products of conception. So if you assess the vaginal bleeding and you are seeing tissues, you are seeing things like flesh, you are seeing tissues coming out, definitely there are fragments of the product of conception. So it means that it is inevitable. And if you don't work on her quickly, the bleeding might become very heavy and she might go into shock. So if inevitable abortion without shock and pregnancy is below 12 weeks, perform manual vacuum aspiration and give post-abortion care if trained. So this one requires that a manual vacuum aspiration be performed. If you start seeing product of conception, like you see tissue, you see some part of the flesh, you see the hand and coming out. So these are situations that you can't help such situations again, and the cervix is already dilated. The cervix, the os is open, so it's not closed. So that alone is a sign that the pregnancy will not stay. So may see vaginal bleeding, low BP, high pulse rates, and cold clammy skin. So these are some of the other signs you may also see in the case of inevitable uh, case, in the inevitable case of bleeding per vagina. So if the pregnancy is over 12 weeks and the patient is in shock, set intravenous infusion of normal saline and refer. A pregnancy of 12 weeks definitely needs higher intervention. So you may need to refer and try to stabilize her by giving her IV fluid. If bleeding is not much or cervical os is closed, advise on complete bed rest. That means that's like a threatened abortion, and she will need complete bed rest so that the stress she has engaged in will not be much on her and she will not lose the pregnancy. Then you can place her on folic acid, ferrous sulfate, and review her condition in 3 days. So this is the step that should be taken. So the next thing after this is to harmonize the instructions about the two complaints. In case of maybe two complaints, you harmonize them, you do the required actions under the findings from the other fever or headache and for the bleeding, and you bring them together and you write them down as one, and you make appropriate use of referral form where they require that you should refer the client. So you harmonize everything in one statement or in one action plan. Then you give health education as appropriate on adequate bed rest. If you are telling her to go on adequate bed rest for 3 days, then you must tell her how she can do that. And nutritional counseling, personal food and environmental hygiene, mental health counseling, anyone that is applicable to her based on the history you have taken is what you are expected to do as health education. So because in your time of taking history, you would have seen some areas of lapses where you think might have caused her current condition. So all these are health education topics that you can choose from and give. It's not necessarily that you must give all this health education during your practicals. So the one that is applicable to the current clients that you have is the one you will choose. If her case is adequate rest, then you need to talk on adequate rest and tell her what to do to prevent such occurrence of bleeding from occurring subsequently. So after that, you give instructions on follow-up. In her case, is to review her case in 3 days, and you complete your document by appending your signature, your designation, and the date at which you have attended to the client. So don't forget to share this material, share it among your colleagues, share it among your friends in the schools of health and colleges of health, so that they can quickly go through this and be able to get one or two things from this brief lecture note. Then, as well, don't forget to like our page and subscribe to Tutor Abe page, so that subsequently, when I post anything concerning community health, you will see it. So thank you for your time. God bless you. Remain blessed.